The regional committee meeting being held in Khartoum, Health for All, by all. First, for our regional director, Dr. Ahmed El-Mandhari. Welcome.
Thank you, Dr. Ibrahim. My pleasure.
Everybody says health for all. But as soon as you came to the region, you made it health for all, by all. It sounds so beautiful. What did you mean when you said by all?
Thank you very much, Dr. Ibrahim, and I'm really pleased, to meet you and ask that question. Because this is the question, in fact, asked by many of the healthcare professionals, many of people who came across this sort of, vision summary. Me being a family physician and going through my medical study and then postgraduate studies, and then later on becoming on the administrative side and leadership side at a university hospital, and then at Ministry of Health. And based on the readings that I have made, I really felt that, the Al-Mandhari Declaration, Health for All by the year 2000, and thus, voices raised by many member states and many countries about why did not really reach that sort of vision.
Why we never
achieved it, by the year 2000. I thought there is something is missing, something is missing not to reach that sort of target. And then when I came here for this post in EMRO, I shared this view with my colleagues, with the experts and the wisdom here in the region. And then I thought the missing link for that is involving all.
We were trying to do it alone, so
involving all is the only and maybe the best way of reaching that target, health for all. And what I mean here by all, it is Ministry of Health, yes, as a coordinator of healthcare services in any country, but we have to involve communities, individuals in these communities. We have to involve all government sectors. We have to involve all non-government sectors. We have to involve all United Nations agencies and sister entities.
Part of everybody's life.
Part of everybody's life. And second thing that, it is not meant only for within the country, but for me, by all, it is meant among member states within the region itself.
Okay.
And also, if we go more than that, it is meant among all WHO regions, the 6 regions among the WHO. Each region may learn from the other region. Each region may support the other region. Similar to each member state can support other member states when it comes into health for all.
I think you said something that touched me very much. We lack resources in many cases, and yet we're all human beings. And in one region like ours, there is a lot of diversity, the rich and the poor.
Exactly.
So at certain times, when there are emergencies, when there are difficult periods, I think some of the richer countries should support some of the poorer.
Exactly. I totally agree with you, Dr. Ibrahim. And in fact, if we go even to the same country with low resourced levels, communities, they have a lot to offer. Even poor people, they have a lot to offer when it comes into the health of the country itself. And we have many good examples and many success stories in rich, well-resourced countries as well as in low-resourced countries. Many examples of success when it comes into promoting the health of everyone in the country. We just need to explore and mobilize communities, and they will do it perfect.
Dr. Mandhari, since this is the first RC that is being held under you, I want to know your reflections on this year's RC here in Khartoum and the warmth we've been met with.
Thank you, Dr. Ibrahim. In fact, as you said, this is my first experience of attending an RC meeting at this level. And I felt really, very proud of having the RC meeting, my first RC meeting here in Sudan. And from the first day we came to Sudan, I felt it, I noticed it that we are going to have a very successful RC meeting. By all means, from the reception in the airport, with the warm welcoming, from the preparations for the meeting here in the hotel, walk the talk we have had.
Great in that.
Exactly, walk the talk the 2-3 days back, and everyone is mobilized and involved in it. The heat, among everyone to do it exactly,
in spite of
to do it in a very successful manner. So I'm really very optimistic to have a very successful meeting, and it will be followed with a very successful implementations of whatever recommendations that have been decided.
Thank you so much. And it really proved that the variety of countries, whether rich or poor, when the heart is there and the warmth is there, you succeed.
We can make miracles.
Thank you so
جزاك الله خير دكتور
Thank
إبراهيم.
you.
أحسنت.
Thank you.